Hello, my name's Mathew Shaer of the West Midlands Police. I'm part of the command team for Birmingham West Policing Unit. I think it's important at the outset I just make clear that the views I'm going to represent are my own, not necessarily representative of the organisation. I've been asked to give some background to my professional career, the majority of which has been spent in homicide investigation and dealing and tackling gangs and gang criminality. I was also privileged to spend 2 years on secondment to the London Serious Youth Violence Board at a time when I was part of the Metropolitan Police Service. Out of that, one of the elements that was born was the 99% campaign, a campaign that I'm very proud of because it still continues. It was born out of a need to challenge the stereotyping of young people, because the fact is the vast majority lead meaningful lives, positive lives, who contribute to society. And it's really important that the stereotypes that they are somehow all involved in youth violence really does need to be challenged. Now, we are in yet another cycle of youth violence. Some of us would say that it's actually never gone away, and certainly I think the concern to communities has never gone away. But nevertheless, we are in a period where the media are heavily focused on this issue. It's understandable. But perhaps the important question to ask is why are we here again? I would say it's because we have had a failed cycle of partnership working in the past, where typically enforcement has been the central strand around which everyone has focused. And the reality is enforcement is sustainable in that sort of level, that sort of intensive level for a period of time, before which another crisis in policing or society emerges. And because those partnerships aren't sustainable, because they are focused so much on enforcement, they tend to disappear into the ether, because the new challenge, the new crisis is what dominates everyone's thinking and energy. So I think it really is important that we start to think differently. It's something that in Birmingham we've certainly been doing. And this is not only to partnership work in itself, but to the violence problem. And if you're going to start thinking differently, the first thing you need to do is start speaking to people who think differently, because they will challenge the status quo. So in Birmingham, in the West Midlands, we are taking a public health approach to the violence, understanding that violence is contagious. But if you're going to do that approach, you really must start with agreeing what every partner considers the golden thread. Rather than having enforcement at the heart, what is it that actually will bind people together, bind partners together? So for us, it's been adverse childhood experiences. It's something that every partner has a vested interest in. Then you need to actually define what a public health approach means. And we've been doing that, but it does take some work, because it really is a term that gets bandied about quite often at the present time. And I'm really concerned that people don't necessarily fully comprehend what it means in detail. So we've spent quite some time doing this, and we understand what it means, and we've defined what it means for education, for example, the criminal justice system, for housing, for policing, and for the partnership itself, having that adverse childhood experience as the golden strand, as we call it, that runs through everything and all of our thinking. But if you're going to start thinking differently, you also need to start thinking differently about the role of the community, because they are absolutely essential to this. And one of the starting points that I'd like to challenge people's thinking on is the role of faith. Now, the reality is, if you look at youth violence and if you look at gangs, faith is consistently one of the routes out for people. And if it's one of the routes out, why are we as statutory partners so frightened, and I'd use that word deliberately, about talking about the issue? And I think it's time that we actually embraced the fact that there are partners out there that can really help us on this journey. So we are fully engaged with our faith partners in understanding the role that they can play. It's also about understanding the voice of young people. I talked about the 99% campaign. So often the voice of young people gets forgotten in this. And if you're going to start thinking differently, young people need to be at the heart of that. But I'd also start to challenge people's perception on what community mobilisation really could look like. I think sometimes it can be too superficial. I think we need to think radically on it, and I think we do need the community to really step up on this in terms of the leadership that they offer to themselves and to others, and to the amount of energy that they can apply to some of the solutions. Now, don't get me wrong, enforcement really is important. You have to get enforcement now right, because that deals with the here and now. And the here and now is what we're seeing in the press. And if you don't tackle that problem, it acts as a magnet to draw all the energy and resources away from that longer term delivery on a public health approach. So enforcement is important, you have to get it right, but it is not the central focus. It is about enabling that longer term approach to deliver whilst dealing with the here and now concerns. And finally, I would talk about hope and ambition. If you're going to think differently and if you want to make a difference, the communities want to know that you've got a big ambition to change things, and that you need to provide them with the hope that things are going to be done for the better.